Thank you, Tom. I'm here today with David Ring. He is the section chief of the FBI Cyber Division Outreach Section. Their role is to disseminate cyber threat intelligence to the private sector and to work with us. So Dave is a good friend, and he's in fact occupying the position that I previously held at the FBI just before I retired. Dave is a nearly 20-year veteran of the FBI, serving in a variety of analytical and operational roles. In fact, we worked together very closely many years ago in the counterterrorism of the FBI. Dave, understanding the threat picture is changing moment by moment, could you give us a general overview of the cyber threats which we might be facing? We're really concerned about the two destructive malware variants that were identified on February 26th by FBI and CISA, Whispergate and Hermetic Wiper. Could you talk to us a little bit about that?
Of course, first, John, I just want to say thank you for having me on and inviting the FBI to have this conversation. We're in a very critical time, and this is a very important conversation to have. So, specific to Whispergate and Hermetic Wiper malware, I direct everybody first to the CISA.gov/shields up site or IC3.gov to review our joint CSA. You could go to CISA.gov, and right on the banner is a link for Shields Up. That CSA includes technical details and really everything network defenders need for prevention and mitigation. Lists identified indicators of compromise for both malwares, as well as instructions for how to handle destructive malware as a whole, potential distribution vectors, and pages of recommendations in terms of best practices and planning strategies that should be employed to protect against and, if infected, respond to destructive malware if it were to affect your organization. Moving into the broader threat, nation states are using both intelligence and military officers as well as criminal proxies to carry out malicious cyber activities. These groups often blend common but effective tactics, including spear phishing, brute force attacks, and exploiting known vulnerabilities against accounts and networks with weak security to gain initial access to victim networks. Now, that said, we're particularly focused on a few issues with the Russians, to say the least. The same unauthorized access that enables data exfiltration can also usually allow data destruction and other means of disrupting a victim company. We've observed Russian military intelligence actors conducting disruptive and destructive cyber attacks since 2015. For that reason, the FBI has a very low threshold for action. Similarly, we remain concerned that Russian cybercriminals will target U.S. critical infrastructure, in particular, financial services sector, energy sector, and of course, we're very much concerned about potential targeting of the healthcare sector, given the imminent threat it could have on public safety. With ransomware attacks either in support of the government or to take advantage of an even more permissive operating environment in Russia, our concern persists through this current threat environment. That's why we're focused on the whole gamut of the threat emanating from Russian intelligence services and cybercriminal groups at this time. Finally, Russian cyber actors also are known to gain unauthorized access to sensitive or secret information from victims and then publicly releasing some of that information through proxies or false flags. So in some instances, the released information has been modified from its original form and content, and these leaks are designed to sow discord and confusion among the targeted audiences while straining ties between allies. Russian malign influence actors use social media, co-opting witting and unwitting surrogates to disseminate their false narratives to exclude or isolate groups. We continue to identify malign foreign influence actors, expose them, and their schemes to social media providers and the public, and use all of our authorities to hold them accountable.
Appreciate that very comprehensive overview. But, Dave, very specifically, and given what you have said, are there any specific credible threats targeting US healthcare that you or the government are aware of?
So, John, the short answer to that is no. I can't say that we're tracking specific or credible cyber threat information indicating immediate threats to US healthcare entities. I would note just because we don't have specific reporting doesn't mean that threats don't exist. Ransomware and other attacks occur without warning. And right now, absent specific reporting, we can say confidently the threat remains high.
Appreciate that, Dave. The direct answer to a question I get every day, sometimes on the hour. Dave, so given the uncertain future here, what does the cyber threat landscape look like in the coming weeks or months as these necessarily tough economic sanctions against Russia take hold and potentially inflict severe economic strain on the Russian economy and the Russian government?
So, John, I'd start by saying it's really difficult to attribute malicious cyber activity to specific actors, making it equally as difficult to identify with certainty the motivation or specific impetus behind malicious cyber activity. That said, we've been messaging for many weeks that government and private sector network defenders need to maintain a heightened state of security given the potential for increased cyber threats emanating from Russia, specifically surrounding the current situation in the Ukraine. These cyber threats are real, and the atmosphere is one where we here in the government and all of you in private sector need to take all the preventative and protective measures available to ensure our critical infrastructure can deflect, withstand, and recover from cyber attacks, which may come at an increased pace given the current threat environment.
Appreciate that, Dave. And we, as you know, take it very, very seriously here in the US healthcare sector. We've learned some hard lessons from the past, not only from ransomware attacks during the pandemic, but going back to 2017, where we became collateral damage in a massive Russian GRU cyber attack aimed at the Ukraine that spilled over into US healthcare and disrupted healthcare at many facilities and providers across the nation, including major pharmaceutical and a major medical transcription company. You mentioned the steps, taking the steps necessary to defend against, being resilient, being able to respond. Dave, in non technical terms, what are your thoughts on the top few cyber risk mitigation steps hospital and health system leaders should be asking their cybersecurity teams about to defend against the increased threat?
Yeah, I mean, thanks for highlighting that, John. It's one thing to just say that there are a number of steps that should take and that people should take and that organizations should take. It's another thing for us to be able to communicate clearly from here at the FBI as to what our perspective as to what those steps look like. So first, of course, I'd strongly encourage organizations and their network defenders to review the number of cybersecurity advisories we've published. I referenced Shields Up and IC3.gov. They're all on there for folks to view. These CSAs are one of the ways the FBI and our partners quickly share new, important tactical information from our investigations, such as specific Russian malware signatures, indicators of compromise, and changes in their tactics. I'd also advise companies to know their network and what, if any, connectivity they have in Russia and surrounding territories. I'd suggest they conduct an internal risk analysis to determine how network defenders can monitor these remote systems and access points over the upcoming weeks and months. We'd recommend partners exercise cyber incident response plans. Companies should ensure such plans include contact information for their local FBI cyber squad. It's extremely important for all of us to keep our lines of communication open over the upcoming weeks. If a company doesn't have an incident response plan, we strongly encourage them to build one and exercise it now. If a company or member of the public sees any social media posts that are indicative of misinformation or disinformation, they should contact us. It's extremely important that FBI receive these leads quickly. Our Foreign Influence Task Force works with both our domestic and international partners to understand malign influence operations and form a unified strategy to address them. We lead an interagency team with direct connectivity to national and international social media applications. And in situations like these, we communicate this intelligence to social media companies, which then independently evaluate the information for terms of service violations. So, what that means in practicality is if you're seeing that start to happen or you get reports of that in your organization, report that to the FBI, and our action can potentially result in near term to that information being removed. I'd also say that companies should monitor their networks and report any suspicious activity to the FBI. Understanding new malware signatures, indicators of compromise, and malicious actors' tactics, techniques, and procedures in real time is truly one of the most important things to protect all of us. And finally, if they do unfortunately suffer a compromise, call us immediately. I cannot overemphasize how much speed of reporting matters, especially when it comes to a potential cyber attack initiated by Russia or its proxies. And while the FBI is known for a tremendous technical capability in cyber investigations, we also have tools that may be of value. For example, we're happy to coordinate public statements with victim companies as appropriate. If a company needs help
Mm.
safely removing a server to protect PII or other sensitive information, we're happy to provide technical assistance. If a company has employees who are suffering, we can leverage our victim services experts to help them. At the end of the day, our goal is to be the best partner we can for victims, and we ask you to keep that in mind.
Dave, appreciate all that information. There's 2 points that you made out of the many, many good ones that obviously you included in your answer. I'd like to focus on and expand just a little bit, and I'll do that from this side. One, you mentioned the information in disinformation, misinformation, disinformation. In this age, not only are we dealing with the fifth dimension of warfare, like cyber, it was traditionally land, sea, air. Then we moved into space as a dimension of warfare. Then we moved into cyber as a dimension. And now we have the dimension of misinformation and disinformation, the sixth domain of warfare that we must be alert for, which can really impact how we prosecute conflicts and so forth that may contribute to our effectiveness in our response. And I also, speaking of effectiveness and speed, I know the Senate recently just passed legislation out of the House on their incident reporting bill, and we are watching that closely for our listeners. I understand that the reporting, there may be one central point in the government for reporting at CISA. We're watching that. We want to see how that develops. So obviously, of course, we like to work with CISA as well, but we want to make sure that does not slow down the reporting to the FBI as well. That's a concern we've expressed to members. So, not asking you for a response on that, Dave, but that is my opinion on behalf of the American Hospital Association. So, Dave, speaking of incidents, what should be reported to the FBI? It's top of mind for leaders, as you know, so they get it. They need to call the FBI. But what specifically type of threat activity? You mentioned incidents, so forth. What type of specific threat activity should be reported to the FBI? And what type of technical indicators are you looking for? And finally, how do they report that?
Sure, John. First, thank you again for your support and those comments. So, listen, I'd start by going back again to the advisories we're putting out with our partners. Those indicators of compromise, instructions for how to handle destructive malware, distribution vectors, and mitigation best practices are most often gleaned through reporting received from victims. So, if you're familiar with the information we're pushing out, you'll know exactly what we want when it comes to report what to report in, right? And so as you see that activity start to manifest on your systems as network defenders, that's the type of stuff we want to see when you're coming back and reporting to us. And listen, the healthcare sector and across critical infrastructure sectors, you're critical partners, right? And you might and most likely will see the first indications of Russian cyber activity or any adversarial cyber activity. We need you to call us if you see something suspicious or experiencing a problem. The only way we can protect you is to hear from others, and the only way we protect others is to hear from you. So I'd say the best thing you can do, I'll reiterate, is to build a relationship with your local field office. Having a point of contact near you who can respond or send one of our technically trained agents to you inside of an hour in most cases, due to the forward deployed nature of the FBI workforce, is the best case scenario. If you don't have that relationship built, I'd encourage you to seek it today. To get a little bit more specific into how to report, especially if you don't have that relationship when you're suffering from an incident, there are a variety of different vectors, and it can depend on what that the nature of the incident you're facing is as to which direction you should go. If you're suffering from a ransomware attack or other cyber incident that results in your ability to affect patient care, we'd highly recommend that you call the FBI's 24/7 Cyber Operations Center called CyWatch. You can contact them at 855-292-3937. You can also email them at cywatch, cywatch at fbi.gov. For awareness, all that reporting is located at the bottom of the cybersecurity advisories that I've referenced throughout this conversation. It's all there to directly reach out. For less urgent reporting or reporting that isn't really reporting information where you're not sure if there's a real threat, but you want to report it anyway just to be safe to give us that information, we want it. I would recommend that you report it to the FBI's Internet Crime Complaint Center. You can find them at ic3.gov. I referenced that site earlier. That's where we put all of our public messaging and our messaging to industry partners. It's also the interface with the public where anybody in the public can report an incident of fraud or other type of cybercrime. And so when you go to that website, there's a clear box to just click report a crime. And you click that, and there's a form for you to fill out. That information is then routed to the appropriate field office and to FBI headquarters to deal with. But again, I just want to reiterate, build those relationships now if you don't have them already with your local field office. We want to have engagement at that level, certainly with critical healthcare facilities and their AORs. They want to have that direct relationship. And if you do suffer an attack and don't have that direct POC, Cywatch is the place to go.
Appreciate that, Dave. Very, very helpful for our listeners, really, and for the entire nation's hospitals and health systems. Again, to emphasize your points, data theft crimes are different than ransomware attacks on hospitals, which may disrupt or delay patient care, risking patient safety. As we always say at the AHA, we recognize those attacks. They're not financial crimes, those are threat to life crimes. So we appreciate your support in responding to them as such. So, Cywatch for ransomware attacks, folks, to keep that in mind and get those relationships established. If you don't have the relationship, I'm happy to facilitate if needed, but there's far many more FBI agents than myself out there to make contact with. So, with that, we'll conclude for today. Dave, thanks for being with us on this special cyber advisory podcast. Thank you again, and all the men and women in Cyber Division, the FBI, CISA, and all the government agencies who are working 24/7 to defend the nation. And I think we've moved beyond threat information sharing now between FBI and private sector. This is operational collaboration. We're defense, your offense. Godspeed on your mission. Thank you, everybody. This has been John Riggi, your national advisor for cybersecurity and risk.